Fibrous skeleton of heart or skeleton of heart. Definition: it is a heavy fibrous connective tissue. It is heavy fibrous connective tissue lying horizontally in atrioventricular plane, that is the atria, superior and somewhat right, ventricle, inferior and somewhat left. I must say, very beautiful moment. Why? Because today is Pamit's marriage. Pamit की cafeteria में शादी है. Okay. This fibrous skeleton entitled for, I must say, very beautiful moment. I for insulation. That it works as an insulator. It restricts electrophysiological activity of atria above and electrophysiological activity of ventricle below. Must for muscles. These fibrous skeleton give attachment to muscle fiber, the atrial fiber from above and ventricular muscle fiber from below. Atrial fiber superficially, they lie in transverse fashion like this, and the deeper fiber in annular fashion, but they start and ends at fibrous skeleton. Same way in the ventricle, the superficial fiber here at the region of apex form an acute angle known as vortex, whereas the deeper fiber are responsible for making chorda tendineae, but they start as well at ends at fibrous skeleton. Say, that is stitches. This fibrous skeleton forms a holding platform for the stitches in cardiothoracic surgery. Very, V for very, V for valves. These fibrous skeleton in the form of ring, they are arranged in the ring and some straps in between. So it is a holding platform again for valve, that is the pulmonary valve, aortic valve, mitral valve and tricuspid valve. Beautiful, that is bundle of Hess. Here it is in two part, this fibrous ring and these straps. Straps, one is somewhat longitudinal and one is in triangular fashion. In the triangular central part, there is a hole which give way to the bundle of Hess. The only communication through the fibrous skeleton in between the atria and ventricle, the bundle of Hess. So give way to bundle of Hess. Beautiful moment. It give attachment to membranous interventricular septum. This is right ventricle and this is left ventricle. In between these two there is interventricular septum, which has got muscular part below and membranous part above. So this fibrous skeleton give attachment to membranous part of interventricular septum. We have decoded this. Now Pamit की cafeteria में शादी है. We write from anterior. First we write anterior, then write posterior. So likewise, this is anterior aspect, this is posterior aspect. We have to make 4 rings because this is a marriage ceremony. So first make a 4 rings and write PA, anterior and then posterior, and then we write from right to left. So MI and then T. Pulmonary, aortic ring, mitral ring and tricuspid ring. These fibrous tissue are arranged in ring fashion and now they are interconnected. Here the pulmonary and aortic ring, they are interconnected with longitudinal strap and this is known as tendon of conus or infundibulum. C for conus, I for infundibulum. Pamit key. Pamit key. CI key. Cafeteria, that is aortic, mitral and tricuspid. Fibrous rings, they are attached with triangular thickened fibrous part. Okay, so central, as it is centrally located in between these three. Fibrous, made up of fibrous connective tissue, trigonum in triangular fashion. So central fibrous trigonum, CFT, cafeteria. But this central part, the lowermost, which connect the mitral and tricuspid ring, it is somewhat thickened and known as trigonum fibrosum dextrum. It is somewhat on the right side. So trigonum fibrosum dextrum D, and this is towards the left side somewhat trigonum fibrosum sinistrum, which connect obviously the part of central fibrosum trigonum, but it connect aortic and the mitral fibrous ring in pink color. So Pamit की कैफेटेरिया में Shadi, SD, sinistrum and dextrum. So this is all about the fibrous skeleton of heart or skeleton of heart. Thank you.